recent results announced in Washington at the American College of Cardiology Congress from the Fourier trial are particularly important in the field of LDL lowering and atherosclerotic cardiovascular disease. The Fourier trial involved the use of a monoclonal antibody, evolocumab, on top of background statin versus a placebo group with background statin. And over a period of slightly more than 2 years, there was a very significant reduction in cardiovascular events of the order of 20%, slightly more. And for the first time, we have seen that very low LDL levels could be attained. More than 30 or 40% of the total population of 27,500 patients attained LDL levels of less than 40 milligrams per deciliter. This is really unheard of previously. And that was consistent with a continuation in benefit at these low LDL cholesterol levels. Now, this raises an important question, both for clinicians and for patients, and that is, are very low LDL levels, for example between 20 and 30 milligrams per deciliter, are they compatible with normal human physiology? Well, the answer is yes, and the reason the answer is yes is as follows. Professor John Chapman in Dallas some 30 years ago, in pioneering experimental studies, showed that every tissue and organ in the body possessed its own capacity to synthesize cholesterol. This is the first point. The second point, which is particularly important, is that newborns, neonates, and indeed children up to the age of 3 to 4 years actually have very low levels of LDL cholesterol, similar, in fact almost identical, to the levels attained by many patients in the Fourier trial. Now, what we know from Professor Dietschy's work is that during that very early period of life, there is a tremendous demand for cholesterol in essentially all tissues and organs, particularly the brain. And what he showed was that every tissue has the capacity to increase its production of cholesterol as a function of its requirements. And that is especially true for the brain. So in other words, it would appear that as adults, we do not have a physiological need for the very large amounts, the very high levels of LDL cholesterol, very frequently 3, 4, 5 times higher than those that we have as newborns. So there's very strong evidence then that individual tissues and organs can supply the greater part of their needs.